What up? It's a tip of the week, and today we're gonna discuss, so you wanna take out wisdom teeth. All right, guys, let me take my capper off. I just got out of surgery. Once again, the reason why I do this channel is so that you can smile after surgery. I'm a concierge dental surgeon. I have been practicing for the last 10 years. And for the last 5 years, I've been working in Houston doing implants, IV sedation, and difficult extractions for 30 different doctors here in the Houston area. And the reason why I prepared this channel is because I know that there's a lot of doctors out there that want to do more procedures and they want to do them in a comfortable environment. And so what I decided to do was, let me create a channel so I could create tips out there and share with you guys the different tips that have allowed me to do 10,000 cases, work with 30 different offices, and have 5-star reviews and give you all my knowledge. And so if you're watching and tuning in today, what I want for you to do is this: smash the like button, hit the subscribe, send this to all your colleagues, but subscribe to the channel. And I want to know, what tips are aiding you in having you smile after surgery. All right, guys, so today specifically, the question today is talking about how can you prepare to get ready for extractions. All right, so once again, if you're watching any one of these videos, I always want to focus on principles, and I'm going to give you these principles because if you are in your office, working with your staff, on your patients, in the comfort of your own operatory, if you follow these principles, I don't care where you are in the world, you're going to be successful. All right, so number one is this: have a system. Now, I know you're probably like, well, what does that mean? Or duh. Well, the reason why I say have a system is this: it took me about 5 years to perfect my system. I remember I was in Ohio at the time and I just got out of residency. I was working for a FQHC, a federally funded qualified health center. I can't remember the name, but you get what I'm saying. It's called Primary Health Solutions, so shout out to them. I was doing surgeries. I just got out of residency at the University of Pennsylvania, the VA hospital there, and I thought I was the doctor's doctor. I went to an Ivy League training institution, and once I got to Primary Health Solutions, I started working. Well, it didn't go as well as I thought. My focus there was to do a bunch of extractions, do a lot of root canals, so that I fast forward 9 years later, I could be talking to you. And so literally, I didn't realize I was gonna have a YouTube channel to share all my secrets, but I kept on seeing that different doctors were having the same type of challenges. So I was just like, let me create this. So as I was on the path of creating my system, I would take out a wisdom tooth, and literally, I would have patients that would do well and some that would. And I remember there was one day in particular, I did a couple extractions. It was on an African-American, a black female and a white male. I want to say one was tooth number 17, the other one's 32. And so I'm working, I'm in there for about a good 45 minutes to an hour on just the case or the actual just one tooth. But it got away from me. And these individuals happened on the same day, so I'm hammered. Well, the following day they come in and they're walking, and so where my office was, it's right out the window. And as I see them coming in, they're like this. And I'm like, oh my gosh. I was like, crap. And so I remember my mentor at the time, he was like, Jared, what you're gonna have to do is learn how to be a duck. And I was like, huh? He was like, what you need to do is learn how to be cool and calm and collective above water, but paddling like hell under. And when I saw that word picture, I was like, I was dying laughing. And so when they came in swollen, so the first patient was a guy, he's like 6'2", coming in, white guy, comes in and he's just like, hey man, what's going on? And he wasn't like confrontational, but he was like, what's going on? I was like the duck. I'm like, well, it looks to be that you're having a little swelling here. And I was just like, well, let's do this. And I gave him my protocol and he ended up doing better. What happened was I wasn't prescribing any antibiotics or I wasn't prescribing any like really big painkillers at the time. And the reason why is because of the environment that we're in, they were just like, Dr. Williams, if you're gonna prescribe, make sure you prescribe as little as possible. Well, I should have prescribed antibiotics, but I didn't. And this goes back to just having a system and knowing what works and what doesn't. Best practices. So I treat him, I give him some antibiotics, amoxicillin, he ends up resolving. The black young lady comes in. Now when she comes in, my goodness, she brings her mother, her grandmother, her father, her boyfriend, and her 2 kids. And I'm like, oh gosh, here we go. And I'm like, oh Lord have mercy. So when she comes in, right after the guy walks out, literally, like I said, these are on the same day. She comes in to the operatory and she's like, and the grandma's like, and I'm like, and so she's literally walking in and I'm like, all right, paddling like a duck, cool and calm and collected. So I walk in, I see, oh, I see that we have a little induration here. No problem, we'll take care of this. And so I'm giving information to the grandmother. Now hear me when I say this, remember the system. I knew that if she brought her mother in, her mother was gonna be the voice of reason. Because think about it, if you're in pain, how much are you gonna be really listening with your ears? You're gonna be listening with your heart. When you listen to your heart, it's easily to be brushed off on, and if you get brushed up on your heart, then you're gonna go bat crazy. And so when I was speaking to her grandmother, I was also speaking to her and I was just giving her an explanation on what happened and how we're gonna follow up with her and how we're gonna give her medication. Her grandmother was like, I really like this doctor. And she was like, and I saw how she was like kind of warming up and she was like, you know, girl's gonna be all right. And so I gave them the same stuff. Fast forward, they come back a week later, everything's resolved. Guys, I don't want that to happen to you. I want you to have the results of patients coming in, they're now swollen, but I want you to have a system. And if you remember that story that I just shared with you, you are going to have your system and it's gonna change from time to time, but once you get it perfected, you're golden. And I created a course on how to smile after surgery. I give you all my tips and tricks when it comes to doing oral surgery, specifically on wisdom teeth. So if you want my system, go ahead and check it out. It's in the link down below. And I know that you're gonna do well because it's the same exact system I do right now. Like I said, I just had a patient who needed tooth number 32 or lower bottom right wisdom teeth coming out. She's happy, she's out the door, and I did my same exact system, all right? So that's tip number 1, have a system, don't deviate. Once you get it ironclad, don't deviate from it. Number 2 is this, it should have been number 1, but number 2 is this, profound local anesthesia, profound local anesthesia, profound local anesthesia. I wrote a book on it, get the book, it is free. It gives you exactly what I do on all my patients. I don't care if they are 12 or 112. I'm doing the same protocol. You want to make sure these patients are nice and comfortable because if you're going to be doing any type of wisdom teeth that carries already a significant amount of anxiety for the patients, because if you go on YouTube, everybody's looking up these patients who are doing dumb stuff and these doctors that are giving way too much medication and they're coming in thinking that you're going to do the same thing. And you probably are going to do the same thing if you're not watching, if you're not giving you the tips that I'm giving you. But you want to make sure they have profound local anesthesia. Now, that doesn't mean I'm just going to go ahead and, let me see this, let me see. I'm going to operatory, so let me see. So I'm just going to go ahead and give you all these carts right here. I'm just going to drop all these on you. And if that doesn't work, I got a little more. I'm gonna start throwing all these in here, as you can see here. Like, you don't wanna do that, guys. You don't wanna just go ahead and be like, I'm just gonna start throwing on a whole bunch of medication. It's not right. And the last thing you wanna do is have that happen to one of your family members. It's not a place to be. And so by making sure that you know exactly how much you're giving and giving profound local anesthesia, patients will sit there. And I've had patients that I've given them some verbal anesthesia, and if you get the book, like get the book right now, and I'll tell you how I do it, and patients end up just sedating themselves. I kind of do some little, ooh, and they end up falling asleep. It's kind of like I mesmerize them, and they're just like good. And guys, like I'm telling you, like I'm seeing these patients for the first time, and they've never seen me before. They probably went on my website, checked me out, probably watched a video like you're watching now, and they're literally seeing me for the first time, but I have a way I have a system, not me, I don't want to take the credit. I have a system that I've perfected over the last, 10 years now, that I've placed in that book. And when you get the patients mesmerized, they'll do anything you want them to do, not because you're manipulating them, but because you're showing them that you care. And there's a way in which you do that. And caring is making sure you got them good anesthetics so they're not yelling and screaming and saying that doctor ripped up my tooth out my face and it was hurting and all this other stupidness. Because you also got to take consideration, it's not just getting the tooth out, it's also the aftercare. So you want to make sure that they have a good profound local anesthetic so when they get their pain medications, they don't even notice that anything happened. Hint, 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 hint. There you go, all right? So remember that. Number 3 is this. I should have done this all in reverse. No, I don't know why, but whatever. Number 3 is this. Start with easy cases. If you're not used to taking out wisdom teeth, they're very easy. Like I'm telling you, like these sayings that I came up with, you know, what looks hard is often easy. It's true. I live by these. Smile after surgery. These are true. Like the proof is in the pudding, guys. All right. So number 1 is this. Like, start with easy cases. Don't start doing the complete bonings. Don't start doing the impacted bonings. They're just gonna get you in a position where you lose confidence. And when you lose confidence, you can forget about it. I don't care what type of training you've done, you're gonna end up getting on a path where you just swivel out of control and you never want to come back, and it's just like, oh my goodness. That's why I say get a system first, get profound local anesthesia, and then most importantly, start with easy cases. And guys, I'm speaking to myself. Like I said, I've gotten to a point within surgery that I'm not even thinking when I'm doing dentistry. I'm just like, like literally today it's, I don't know, it's like what, almost 1 o'clock, and I'm giving you this tip. I'm in between surgeries. I'm giving you these things. There's no thought that runs through my mind, and the reason why I has no thought running through my mind is because the cases that I'm doing and all the cases I do, I don't want to say they're considered easy, because I don't think anything's easy until it hits that tray. And so for me, I'm not thinking. And if you are doing these cases, there's a lot of anxiety that happens, and I get it. Like, remember the story, I had the patient coming in, 2 of them at the same day, and they're coming in with swelling. And so if you know how to choose easy cases, then you're gonna be easy. And I'll probably make a video on how to determine, you know, what cases are easy or which ones you want to stay with, so you smile after surgery. So if you want me to create a video or a tip like that, throw it in the description, send me a message, I'll get back with you, and I'll do that, because the whole purpose of this channel is so that you smile after surgery. Not I smile after surgery, but you smile after surgery. So keep that in mind. So let me know if you want me to create that video for you. All right, so your word for the day is coronectomy. All right, guys, so if you're gonna be preparing to take out wisdom teeth, I wanna prepare you for certain verbiage that you're gonna need to have in order to smile after surgery. All right, so coronectomy, it's a big word, but I'm gonna break it in 2. All right, so it's a big word and we're gonna break it up. All right, so coronectomy literally means coron, which is crown, and ectomy means cut. So what we're gonna do is cut the crown or separate the crown. The reason why I do coronectomies is literally because the tooth is in a position that is causing inflammation or damage to any surrounding structure. And when that happens, the roots that I'm going to intentionally leave, not being trifling, I'm just cutting out the teeth. You don't want to do that. Now there's different things like root banking that you could Google and learn about. If you want me to make a video on root banking, I'll do that as well. The reason why I do coronectomies, the reason why you need to have this verbiage in your arsenal is because when you are thinking about doing a coronectomy, you're intentionally leaving the roots. And the reason why you leave the roots is because the roots are literally in a position where you can't access the whole thing. You're going to cause more damage to the surgical site, and most importantly, the patient that's connected to that surgical site, more hurt than harm. And so by doing a coronectomy, what you're doing is you're allowing yourself to cut the crown, which is a quicker, faster, easier process, and the reimbursement is pretty good as well. And second, you're wanting to leave the roots intact so that either work their way up to the surface that you could easily pluck and pull, or they'll just lie dormant. All right, so that's your word for the day, for this week. Coronectomy, I want you to use it. Google it. If you are here in the States, the code for it is 7241. I'm not 7241. So that code is going to be D7251. Once again, it's D7251. I'll throw it right here so you can have it. Coronectomy, that's a partial removal of roots. And the reason why you do that is if you are going to find yourself being in a bad spot. But no, you definitely, that's one of those things you want to let the patient know before. And so that's your root tip of the week, but most importantly, your vocabulary for the week or for the day. All right, guys. So once again, I'm Dr. Jared Williams, and my focus for you is the smile after surgery. So when you have the patient come into your office, apply these tips. They're easy, they're straightforward, something that you can do immediately. I don't make it to where you have a lot of equipment and all this extra stuff. I like to make things quick, easy, and simple. I like to apply the easy method, which is impactful, sustainable, and efficient. Say it with me: impactful, sustainable, and efficient. If it's easy, then it's the JW method, and that's how you'll smile after surgery. Remember, what looks hard is often easy. Make it a great one.